As Nigeria eases the lockdown, it is important to note that the infection rate has not peaked.
Violation of physical distancing, wearing of face masks has shown that a lot of Nigerians are still unaware about the havoc that COVID-19 can cause. Parties, burials, rallies are some red spots for the transmission of coronavirus.
Improved awareness at the grassroots could limit the spread of infection. Joining us now via Skype is Chairman, Association of Public Health Physicians of Nigeria, Lagos Branch, Dr. Tolu Olufunlayo. Dr. Olufunlayo, good morning. It's good to have you join us now.
Good morning. Thank you for having me this morning.
Great. Now, the Federal Ministry of Health as well as the Presidential Task Force have all expressed their frustration one way or the other when it comes to people's lack of adherence to the health protocols against COVID-19. But some people have likened it to inadequate awareness in the grassroots. I wonder if you feel that we don't have enough awareness at the level of the grassroots.
Thank you. I won't say we don't have awareness going on. The issue is how effective is the awareness. To be able to engage people and actually have behavior change, risk communication must be done in such a way that the people recognize the risk of the problem. They have the opportunity and the motivation to change. And I think some of these elements may be lacking. So it's important that we review or evaluate our risk communication strategies so that they can be more effective, especially to the common man.
Now, the infection rate is said to not have peaked. That's according to the reports we're getting from the Presidential Task Force and as well as the NCDC. Now, with these violations at gatherings, it has been rightly pointed out, what concerns do you foresee, especially when you talk about the fact that there has to be a review of our risk communication strategy?
Well, the issue with mass gatherings, again, is perception. First of all, people feel that, they have other needs. They have needs that are greater than a disease that they don't see as a threat. Amongst the grassroots, a lot of people seem to have gotten this perception that COVID-19 is a disease of those rich people there. Now, on the other hand, culturally, for example, when it comes to burials, people feel that they must pay their respects to the dead. So if there is no enforcement of the policies that have been put in place, for example, limiting gatherings to a certain number, whether 20 or 50, which have been flagrantly disobeyed in recent times, then you find out that people are just going to be overwhelmed by emotion and they will come out and want to pay their last respects. You also have the issue of psychophancy, eye service, and so on. So there's a lack of perception and understanding that what they're doing, that singular act, could actually expose them to something that is of high risk to them.
All right, the government is looking at improved awareness, and some cross-section of Nigerians are saying that perhaps we need to begin to look into involving those whom have recovered from the virus to perhaps be part of the advocacy such that people at the grassroots can trust the government and believe the message it's trying to pass across at this time.
Well, that's true. Having people who have already had COVID-19 getting more involved in risk communication and advocacy would help. However, there is also the challenge of possible stigmatization. And that may be one of the reasons why you don't see the average common man coming out on the street to say, I've had COVID-19. So there's a real big challenge there. But I think it's something that can be worked on to ensure that the message becomes more real and that the perception of risk is accurate, that people actually realize, the common man on the street actually realizes that he or she is actually susceptible to having COVID-19.
All right, Doc, some people have talked about issues of enforcement. There has been a persuasive message. The tone has been persuasive all the while, trying to talk to Nigerians regarding the use of or the adherence to all the protocols. But if that is not working, would you advocate that there should be some level of subtle enforcement where people have to, must have to adhere to some strict standards?
Well, thank you. I think you've put it well. There must be a balance. It would be nice for persuasion to work, because when people are persuaded, then there is what we call motivation to carry out whatever preventative action it is, whether the enforcing agency is there or not. However, there must be some aspects which can be enforced. For example, we have said that mass gatherings should not pass a certain number. But day in, day out, we see these kinds of rules being violated and flouted without any consequences. So in as much as we want people to be motivated, because that's one of the major ways by which behavior change takes place. You want the person to want to do it on his own, as well as being capable of doing it and having the opportunity to do the preventive action. However, some activities can be enforced. And if there's enforcement in those areas that will bring the highest rewards, and you balance that with persuasiveness and adequate risk communication, i.e. letting the person understand the risks that accrue to him if he does not carry out that action, then we may begin to see more results. It's a multi-pronged approach that must be taken. No one approach will give us the maximum results because it's a very complex issue. Human behavior is a very complex issue.
Now, there are concerns because this is at the grassroots, and a cross-section of Nigerians are also concerned about the fact that most of the areas at the grassroots do not have the necessary, in terms of potable water, if they are to wash their hands, they do not have that provision. And every other thing necessary, in fact, before we take a step to talk about the use of face masks, I wonder how we can begin to look into that aspect as we speak at this time.
Well, this just speaks to our weak systems, weak health and development systems. And this may well be another opportunity for us to begin to strengthen them. It's not something we can do in one day or week. It's something we have to work on. But if people do not have the capability of carrying out a preventive action, that action is not going to happen. So if we talk about the rural areas, and they have no water, and they are resource poor, they therefore cannot purchase hand sanitizer. So how do you expect them to have clean hands in the first place? So definitely, if there's any community transmission in such an area, it is going to spread. Also, in such areas, the facilities for testing would be probably fewer than in an urban center like ours. So all these are challenges. Our rural areas must be well developed. They must have the basic essentials. However, for now, the government partnering with other organizations, non-governmental, and the communities now have to partner to think outside the box and decide what solutions would be best to fill in as interim measures before we can go ahead to actually provide this needed basic infrastructure that is necessary to just prevent disease and keep populations healthy.
All right. We see in New Zealand, they are calling for, they're reimposing some public restrictions. And we've also seen this in local authority within other countries as well. If the numbers are still up there and the persuasion is not working and there is no enforcement like we see, would you recommend that there should be some level of reimposition of some of these public restrictions?
Well, that's also a balance. It's between the devil and the deep blue sea, as they say, in the sense that some countries have seen the people revolting when restrictions are imposed. Now, remember, in the more developed countries, they are able to provide some form of social security, some form of palliatives for the people when there are lockdowns. I mean, we have most of our industries right now, the different sectors, need finances to be able to set up for the new normal. So if we want to reimpose public restrictions, there must be provision for these palliatives. Otherwise, people will revolt because it will now be between the COVID-19 virus and the so-called hunger virus. That hunger is a greater driving factor than an illness that is perceived by many not to be of threat to them. But please, I want to make the point that it is a threat to every person. So,
all right. Dr. Tolu Olufunlaya, thank you so much for speaking with us.
Thank you for having me.
Thank you.
All right.